Did you know that rectal stool impaction sends hundreds of thousands of older adults to the emergency room every single year? And some of them arrive too late because the warning signs looked like nothing more than a stubborn case of constipation. Stay with me for the next few minutes because I am going to walk you through the 5 immediate steps that can break an impaction safely at home. The danger signs that mean you need to stop and call for help right now. And the one mistake almost everyone makes at the medicine cabinet that can turn a bad day into a life-threatening emergency. The title on screen right now reads, Rectal Stool Impaction. These immediate steps can help. And that is exactly what we are going to cover. No fluff, no scare tactics, just the practical playbook I wish every caregiver and every older adult knew by heart. Before we get into the steps, let me set the scene, because this is a problem most people do not see coming. Constipation is one of the most common chronic complaints in older adults. Published reviews put the prevalence somewhere around half of community-dwelling seniors, and figures for nursing home residents run much higher, with some national surveys reporting rates above 70%. When constipation goes unmanaged for weeks, the stool that sits in the rectum and lower colon dries out, hardens, and packs so tightly that the body can no longer push it out on its own. That is a fecal impaction, and it is not just uncomfortable. Cleveland Clinic, Stat Pearls, and the Mayo Clinic teaching materials all describe it as a condition that can progress to bowel obstruction, stercoral perforation of the colon, urinary retention, and overwhelming infection. The frustrating part is that the early warning signs are quiet. A few skipped bowel movements, a dull heaviness in the lower belly, skid marks in the underwear from so-called paradoxical diarrhea, where liquid stool leaks around the blockage, and maybe a feeling of rectal fullness that never quite goes away. Many people dismiss those signs for days, even weeks, because they do not feel like a real emergency. By the time severe abdominal pain, vomiting, a hard, swollen belly, or bleeding shows up, the situation has often moved from something you can manage at home to something that needs a hospital. Here is what we are going to do today. I am going to give you 5 steps you can take right now if you suspect a rectal impaction, ordered from the gentlest and safest intervention to the most aggressive. Step 1 is recognizing what an impaction actually feels like, so you do not waste time treating the wrong problem. Step 2 is the warm water and positioning routine that helps most people get started. Step 3 is osmotic laxatives like polyethylene glycol, the one option that has the most published evidence behind it. Step 4 is the rectal options like a glycerin suppository or a properly chosen enema, with a strong warning about the kind of enema you should never use on an older adult. Step 5 is knowing exactly when to stop home treatment and get professional help, and that step might be the most important one of all. By the end of this video, you will know more about how to recognize and break a rectal impaction than most casual internet searches will ever give you, and you will know how to do it without creating a worse problem. Step 1 is recognizing the situation properly. A true rectal impaction is not just hard stool. It is a hard mass that has been sitting in the rectum, often for a week or longer, that the bowel cannot move. The textbook symptoms, confirmed across Cleveland Clinic, Stat Pearls, and Mayo Clinic teaching material, include a constant urge to have a bowel movement with nothing actually coming out, lower abdominal cramping, a hard distended belly, nausea, loss of appetite, and that strange leak of liquid stool around the blockage that looks like diarrhea. In older adults, you may also see confusion, agitation, or a sudden drop in blood pressure, because severe impaction can trigger a vagal response and can press on the bladder hard enough to cause urinary retention. There are published case reports of fecal impaction presenting as overflow diarrhea plus acute kidney injury from obstructive uropathy, which is a fancy way of saying a packed rectum can pinch the tubes that drain the bladder. If any of those red flag symptoms show up, severe pain, hard swollen abdomen, vomiting, fever, or bleeding, the right move is not step 2. It is the emergency department. Jumping to home remedies at that point can be genuinely dangerous, because aggressive oral laxatives on top of an obstruction can cause perforations, and a phosphate enema on top of a damaged colon wall can cause electrolyte collapse. So before you do anything else, ask yourself honestly, is this just stubborn constipation, or is this something more serious? If you are not sure, the safest answer is to call your clinician and describe what you are seeing. Step 2 is the gentlest approach, and the one that works for many people when the impaction is caught early. The idea here is hydration, warmth, and gravity. Start by drinking a tall glass of plain water and continue sipping fluids steadily through the day. because dehydration is the #1 reason stool becomes rock hard in the first place. Then get into a squatting position on the toilet, or place your feet on a small stool so your knees sit above your hips. That posture straightens the angle of the rectum and lets gravity do more of the work. You can also apply a warm compress to the lower abdomen for 10 to 15 minutes at a time, which relaxes the surrounding muscles and may help the bowel contract. Some people find that a warm sitz bath, where you sit in a few inches of warm water for 15 minutes, is even more effective because it softens the anal opening and reduces the spasm that often keeps the impaction in place. None of these tricks will break a deeply packed impaction on their own, but they are the conditions that make the next steps much more likely to work. Think of it as preparing the ground before you plant. If you jump straight to strong laxatives without hydrating and repositioning, you are pushing a boulder uphill. Step 3 is oral polyethylene glycol, sometimes sold as Miralax or used as a prescription bowel prep. Polyethylene glycol is an osmotic laxative, which means it pulls water into the colon from the surrounding tissue, softening the stool and increasing its volume until the body can finally move it. The published evidence base for this in fecal impaction is stronger than for any other oral option. Studies and treatment guidelines describe courses ranging from a standard 17 grams a day up to much higher disimpaction doses, sometimes 1 to 3 liters of a polyethylene glycol solution taken over several hours, or daily doses of up to about 1 gram per kilogram of body weight for a few days under medical direction. The reason this matters is that older adults in particular tolerate polyethylene glycol well because it does not jolt the bowel the way stimulant laxatives do. It also does not usually cause the cramping and electrolyte crashes that come with harsher agents. If you are caring for someone at home, the practical approach is to give a standard adult dose with a full glass of water, repeated as the label directs, and keep the person hydrated with additional clear fluids. If there is no result in 12 to 24 hours, and the warning signs from step 1 are still mild, you can increase the dose within the limits on the package. But the moment severe pain, vomiting, or swelling shows up, you are done with home treatment. Step 4 is where most people go wrong, so I want to be very specific. Once oral laxatives are underway, there are 2 rectal options that are reasonable: glycerin suppositories and small volume saline enemas. Glycerin suppositories work by drawing a small amount of fluid into the lower rectum and by providing lubrication, which often allows a small piece of the impaction to pass. They are gentle, cheap, and widely available. A small saline enema, often called a sodium chloride enema, can reach a little higher and soften stool that the suppository cannot touch. Both of these can be useful. Now here is the warning. Avoid sodium phosphate enemas, the kind often sold under brand names like Fleet in older adults. The FDA issued a safety communication about oral sodium phosphate laxatives, and a separate body of literature has linked sodium phosphate enemas to severe electrolyte disturbances even at standard doses in elderly patients, including deaths from hyperphosphatemia and acute kidney injury. Stercoral perforation of the colon itself carries a mortality rate reported in the 30 to 55% range across surgical series, so adding a caustic enema on top of an already stressed colon wall is a combination you simply do not want. Tap water enemas and soap suds enemas carry their own risks of electrolyte shifts and mucosal injury. If you are not sure which enema is in your medicine cabinet, do not improvise. Stick with glycerin suppositories, and if those are not enough, ask a clinician about the safest enema option for your situation. Step 5 is the step I want you to treat as non-negotiable. It is a clear list of the moments to stop home treatment and seek professional help, either by calling your doctor, going to urgent care, or going directly to the emergency room. The list looks like this: severe abdominal pain that is getting worse, especially if it is localized rather than crampy, because that can signal a perforation or ischemic bowel. Repeated vomiting or the inability to keep fluids down, because that means the impaction has moved from partial to full obstruction. A hard, swollen, or visibly distended belly. Rectal bleeding that is more than a small streak on the toilet paper. Fever, chills, or a fast heart rate, any of which can mean the bowel wall is compromised and bacteria are entering the bloodstream. Sudden confusion, dizziness, or fainting, which can reflect dehydration, sepsis, or a vagal event caused by straining on top of a packed rectum. And finally, anytime you have tried gentle home treatment for 24 to 48 hours without progress and your symptoms are not trending in the right direction, In a clinical setting, the team will typically confirm the impaction with an abdominal exam and often an abdominal X-ray, then perform a procedure called digital disimpaction, where a clinician uses a gloved, lubricated finger to gently break up the mass and extract it in pieces. They may also follow that with a higher dose polyethylene glycol regimen to clear the rest of the colon. Cleveland Clinic and the medical literature describing digital disimpaction list the same set of risks, including anal fissures, sphincter injury, rectal perforation, hemorrhoids, and infection, which is exactly why it belongs in trained hands rather than in a do-it-yourself attempt at home. Now let me back this up with the evidence I have been referencing, because nothing I have told you is opinion. Constipation disproportionately affects older adults, and large national surveys have reported that constipation affects more than 70% of people living in nursing homes. Fecal impaction is one of the most common reasons for that group to present with a bowel obstruction, and it is also a documented cause of acute urinary retention and obstructive uropathy because of how close the rectum sits to the bladder and urethra. Stercoral perforation, where the colon wall actually tears from the pressure of hardened stool, carries a mortality rate reported in the 30 to 55% range across surgical series, which is why prevention and early recognition matter so much. Polyethylene glycol-based oral regimens have a published track record in resolving fecal impaction in older adults without the electrolyte volatility of older stimulant laxatives. Sodium phosphate enemas, on the other hand, have been linked to severe metabolic disturbance and death in elderly patients, even at standard doses, which is the basis for the FDA's safety communication and the reason most geriatric guidelines now steer away from them. Paradoxical diarrhea, the misleading liquid leakage around a hard impaction, is a well-described clinical sign that often sends people chasing the wrong treatment with anti-diarrheal medicine, which then makes the impaction worse. Every one of those points is in the peer-reviewed or institutional sources I have been drawing from, and you can verify any of them with a quick search if you want to. Let me bring this all together so it stays in your head. Number 1, recognize the impaction early and rule out the red flags that need a hospital instead of a home remedy. Number 2, hydrate, warm the area, and use proper squatting posture to give the body a chance. Number 3, use oral polyethylene glycol at the labeled dose, increase only as the package allows, and stay hydrated while you wait. Number 4, support the oral work with glycerin suppositories and avoid sodium phosphate enemas in any older adult. Number 5, know exactly when to stop and call for help, and let a clinician handle digital disimpaction and any imaging or follow-up rectal regimen that may be needed. If you do those 5 things in that order, you give yourself the best possible chance of breaking the impaction at home without creating a complication that lands you in the operating room. Here is the scenario I want you to imagine before we wrap up. Imagine an older parent or spouse has not had a real bowel movement in over a week. The belly is uncomfortable but not yet hard, and there is some leakage that looks like diarrhea. If you ignore it, the impaction can grow, the belly can distend, the bladder can stop emptying properly, and the colon wall can weaken to the point of perforation, a scenario with a mortality rate in the 30 to 55% range, even when surgery is performed in time. If you act using the 5 steps from this video, the odds flip dramatically. That is the transformation I am trying to put in your hands today, and the reason I keep repeating that this is information that can genuinely be life-saving. If this was useful, do me 3 quick favors. Subscribe to the channel and hit the notification bell so you do not miss the next video in this series, where I will cover the 3 everyday medications that quietly worsen constipation in older adults. Download the free checklist linked in the description. It walks you through the exact order of these 5 steps and the red flags to watch for. And drop a comment below telling me whether you have ever dealt with an impaction, what worked and what did not, because the stories from this community help other viewers more than almost anything I can say in a script. Take care of yourself, take care of the people you love, and we will see you in the next one.